Chest pain is really scary, and most people either ignore it or they panic. But the truth is somewhere in between. What we need is clarity. So let's go through the chest pain red flags that no one should be ignoring. If chest pain comes with cold sweating or feeling faint or nausea, that is something we would want to assess quite urgently, because it could be a sign that your heart is under some sort of strain. Women are more likely than men to experience fatigue and nausea instead of the typical chest pressure symptoms. So if you do experience chest discomfort with sudden sweating and feeling sick in your stomach, then that's definitely a red flag. A blood test and an ECG would quite easily reveal what's going on. Chest pain that radiates, especially to the arm, left arm, or the upper back or the jaw, is actually a very typical and reliable pattern we see quite often and can be an indicator of the heart muscle struggling. Many patients describe this discomfort as like a dull ache or even heaviness or tooth-like jaw discomfort. And that's because the nerves supplying the arm and jaw overlap with the nerves supplying the heart, and the brain can't really tell the difference. But it doesn't always necessarily mean it's a heart attack, but it doesn't also have to be very severe symptoms. So either way, these symptoms shouldn't be ignored if associated with chest pain. If you ever experience chest tightness with breathlessness, especially at rest, that is definitely something we would want to evaluate properly. And that's mainly because we know that the heart and the lungs work very closely to one another. And so breathlessness is one of those first symptoms, or can be one of those first symptoms that you experience. However, anxiety can most certainly cause chest pain, chest tightness, and breathlessness, but they often improve with breathing exercises and distraction, whereas cardiac type breathlessness doesn't improve. And so if you have symptoms that last a few seconds, they are often not cardiac. We're more concerned about the heaviness and chest discomfort, band-like chest tightness. Those are the symptoms that concern us more. Pain on exertion and relieved by rest, we call exertional angina. So if you climb stairs or go for a walk and have chest discomfort, which is then relieved by rest, should never be ignored. In fact, it could be an indicator that there is reduced blood flow to the heart, and therefore, even if the symptom is mild, the pattern itself is key. Chest discomfort with dizziness or near fainting or feeling faint could potentially indicate that the heart rhythm or blood pressure isn't keeping up with the body's demand. So it doesn't necessarily mean something is dangerous imminently, but it also shouldn't be ignored when you have chest symptoms associated and paired with dizziness. So I hear you ask, who is at risk? So I'll put a quick list up for you now, but the truth is, heart problems can happen at any age, and none of these problems listed here guarantee a heart problem. You can most certainly have chest symptoms with anxiety, muscle strain, or even acid reflux. But if you have recognized any of the red flags that we have discussed today, a quick ECG, a blood test, and sometimes a scan can very quickly give you reassurance. Thank you so much for watching, guys, and I'll see you in the next video.